We are talking to people who have been outspoken, fighting for the health and safety of essential workers who, in a disturbing trend, have been punished for whistleblowing. Now, Lori has been a nurse in Chicago for 12 years. She claims she was fired after sending an email to management and 50 coworkers voicing her concerns regarding the safety of hospital staff. Now, Lori says she will not be silenced and is speaking out publicly because she claims that she's seen so many nurses in her situation standing up for their safety only to be disciplined for it. She joins us today alongside her attorney, Blake Horwitz. So thank you both for joining us. Lori, let me start with you. You've been a nurse for 12 years, and now you just feel like you don't have the personal protection equipment necessary to be working with this highly infectious population, correct?
Absolutely, Dr. Phil. Absolutely. I've been a nurse for 12 years. I've been in healthcare for 19. And what I'm seeing right now is I am just in shock over it.
Is this happening because they just don't have the equipment, or why is this happening? It can't be that they don't know that it's necessary. I mean, people on the street know what's necessary. I can't believe that administrators of the hospital don't know better.
So my story did happen weeks ago, and we were one of the hospitals, Northwestern Memorial in downtown Chicago. We're one of the hospitals that had COVID-19 patients first. Obviously, Chicago is a large city, and Northwestern Memorial Hospital is the #1 hospital in the States. And, to be honest, Dr. Phil, at that time, I don't know whether or not they had enough N95s or not. From what I did hear from another coworker, they did say that they saw management take away our N95s on our units. They hide them from us, but I didn't see that myself.
Okay, now you wrote an email, and this email went to management and coworkers, and every coworker it went to was on your floor, right?
Correct, Dr. Phil.
And that means every person that was on your floor had access to every record on your floor, every patient on your floor, correct?
Correct. It was about 50 employees that I sent the email to.
Okay, and I'm asking that for a reason, because your attorney is with you. Blake, part of the reason that Lori was disciplined and fired here supposedly was violation of HIPAA guidelines. And if this email went to management and people on the floor that had a duly authorized right to these records, how is that a violation of HIPAA?
It's not. HIPAA is for a patient. It's private information, medical information regarding one patient. So if it's a violation of HIPAA, then right now we're violating HIPAA, because right now we're talking about the need to wear a mask. Lori just talked about the need to wear a mask. She didn't talk about specific individuals and bring up their cases with their names, et cetera, and detailed private information regarding patients. To say it's a HIPAA violation is just plain old silly. There's no legal, it's just completely inaccurate.
She didn't say, Bob Jones XXX in bed XXX has YYY, and therefore I feel like I need to do such and such. She just said, I'm in a hospital floor, we need protection.
Right. The only thing that I could think of is, as you know, her case is getting some notoriety as well. And in order to combat it, they just say something, because if somebody can hear there's two opposing positions, then maybe the viewing public will say, oh, there's a legitimate reason. There's no legitimate reason. There's no alternative position. She was fired 24 hours after she sent out this email to 50 people, and she cited no particular patients in the email. It's a very simple and short email.